Hello, my name is Cindy Johnson. I'm Chief Nursing Officer here at Sunrise, and I've been within the HCA system for over 42 years.
Hi, I'm Courtney Ogle, Assistant Chief Nursing Officer, and I started here at Sunrise in 2016, and this is my first HCA hospital. I look forward to getting to know all of you.
You're joining a most amazing nursing team here at Sunrise. We have very many opportunities for you. One of the things that I'm always very proud about is how we connect with one another. We're such a great team. There's so much to look forward to so far as working with physicians, working with nurses, working with our PCTs, also interacting with the senior team. We look forward to seeing you as we make our rounds. Be sure to make sure you give us feedback. One of the other things that many people ask us about is joining the Magnet Journey. We will not be doing that. We will be doing Pathways to Excellence. So I need you to be involved in your unit-based councils. Also look forward to you forwarding your education, getting certification, and then also interacting with your peers as it relates to new processes that we can develop, and also how you can interact with the senior team on a daily basis on different things that you would like us to do.
If you are not aware, Sunrise Hospital is a part of HCA, which is Hospital Corporations of America. And at the corporate office in Nashville, Tennessee, we have a chief nurse executive named Dr. Jane Engelbright, and she is at the very top advocating for all of the nurses all throughout HCA, which is a nationwide company. We even have hospitals over in the UK. Throughout the company, we are broken down into several different divisions, and we are in the Far West Division, which is 3 hospitals in Nevada and 5 hospitals in California. And our division office sits out in Henderson in the Green Valley area. And this is our division chief nurse executive, Sherry Chavez. You'll see her in and out of the hospital from time to time, so be sure to look for her. This is Cindy and I, as you already know, the Chief Nursing Officer, Cindy Johnson, and I am the Assistant Chief Nursing Officer. This is our org structure for our division office. So as I mentioned, Sherry Chavez is our Chief Nurse for the division. We also have a VP of Care Excellence, so that is the person that oversees all of our patient experience. And that is not just nurse related anymore, that is a whole team approach. So you'll see that we're including our ancillary departments and our PCTs into all of our focus on patient experience. We have a Vice President of Nursing Operations, Nursing Informatics, Nursing Analytics, and Nursing Education Vice President. We have recently just went to a division approach for our nursing education. And now we will have service line educators in each areas of the hospital. You'll get to meet them when you're out on your floors. And they all roll up to our division VP of Nurse Education. This is our Sunrise Nursing org chart. You can see Cindy at the very top, our Chief Nursing Officer. And then right now our second ACNO position is vacant. So I oversee the adult hospital, the med-surg, critical care, and burn services. A lot of our operational departments, such as the emergency department and OR, report up through our Chief Operating Officer, but all operation departments that have nurses have a dotted line to myself and Cindy as well. We definitely want you to get involved in your unit-based council, so be sure to ask your nurse manager when your meetings are. I want to show you the next few slides. There's some examples of what your colleagues have been working on in their unit-based councils throughout the year. We always say that we don't want to drive your nursing practice and make all of your decisions, so we definitely want you to get involved and be able to make some amazing changes on your unit. We have unit-based councils and facility-based councils. Here is our Nurse Executive Council. This is our Sunrise Nursing Leadership Council. So this is all charge nurses and above that we meet monthly as a team. We have an Operations Council, which is the nurse managers and directors. As we've mentioned, getting involved in your unit-based councils, here you'll see that we had a unit-based council open house this past fall. And it was really great to see all of the different things that you guys are working on throughout the house. You probably learned a lot about Sunrise Hospital when you were looking for employment here, but we are 762 beds now. We're extremely high acuity, very large, complex facility here. We are located in the urban core of Las Vegas. We have an extremely busy emergency departments. We have a children's emergency department and the adult emergency department, and together we see nearly 160,000 patients per year. We are the only children's hospital. We have a level 3 NICU. If the state of Nevada were to recognize level 4, we would be level 4. We do open hearts for our kids, and we do ECMO for neonatals, pediatric, and adult as well. We are the only pediatric cardiovascular program in the region, and we are a level 2 trauma program, and we have the largest inpatient rehab unit. It's 42 beds, and we do take care of patients on ventilators as well. We also opened the state's only pediatric inpatient rehab unit in 2019. So looking at some of our volumes from 2019, as we talked about being a very busy hospital, we saw nearly 34,000 admissions. We had nearly 1,000 NICU patients this past year and 684 open hearts. So very busy place. We are a regional provider. We do have a pediatric and neonatal transport team. We see about 37 transports per month of our neonates and pediatric patients coming in from all over in the surrounding states as well. Our transfer center is based at our division office in Henderson, and all transfers go through the division-based transfer center. We are a regional trauma service provider. We also recently just opened our burn center as well, so we are now taking burn patients from all over. And we also, as mentioned earlier, are the only cardiac program for children, so we bring in a lot of children to our hospital. We have unlimited nursing opportunities, so many options in our adult and children's hospital. We want to make sure that you are the right fit for your unit. So, you know, if you ever think that you want to try something new or you want to get to that next specialty level, please talk to your manager, talk to one of us. We want to make sure that we get you in the right area, and it's so great that you can have a whole career here just at Sunrise because we have so many opportunities for you. You will always hear the CEO of our company say that nursing is the differentiator for HCA Healthcare, and a few of the different things that we focus on is advocacy and leadership, increased performance visibility, consistency in nursing practice and operations, and leverage scale to drive performance. As you heard us talk about earlier, the care experience, it's very important to us that we focus on a couple of things, and that's courtesy and respect and explaining things in a way that the patient can understand. So those are our 2x2s. You'll hear that verbiage when you're out on the floor. The nurse leaders, including myself and Cindy, will be out rounding, we'll be out validating the processes. So we expect you to do AIDIT anytime you walk into the room, which is acknowledging, introducing, stating the duration, explaining, and thanking the patient. We want to make sure that the patient understands exactly what is going on, the plan of care, and that they always understand who is in the room and that we're explaining. And one way that we can know that the patients are understanding what we're doing for them and what we're saying is that we have them do teach back. So anytime you're teaching the patient or giving them medication or doing a procedure, you always want to have them teach back to you so you understand that they are taking in and comprehending exactly what is going on with their care. This little boy here in the picture was one of our patients that came in and was extremely abused and just in a really bad situation, and because of that he did not have any family with him and no parents. And this nurse, Christine, here behind the mask was one of our pediatric ICU nurses, and this little boy did not want anyone to take care of him. He didn't want to have anything to do with any of the nurses. He was very standoff, And one day Christine was his nurse, and he just absolutely loved her. He was clinging to her, and she would come in on her days off to take him to different procedures, and they truly just bonded. And she actually ended up adopting him, and he's thriving and doing so well. So we don't ask you to adopt any of our patients, but we do want to ask you to treat our patients like they're your family. How would you want your mother or your father or your child to be treated when they're in the hospital? And just think of that every single time that you interact with our patients or go into the room, just treating them like family.
As you've heard, there's many exciting things to do here at Sunrise. You can go to any department, a part of your career mapping, and really get an opportunity to enjoy and enhance your skills. We really want to thank you for being a part of Sunrise, being a part of our nursing department, and we'll see you in the future. Thank you.
Thank you. Have a great day.